Oh, I didn't put in more squash in that. Look like shit. Being shit. So. Oh no, it's too much squash. Fuck. Right, so I'm back now, finally. I started this video probably somewhere around a month, maybe 2 months since I started this video. Working through all the things I've had to do to try and, one, overcome my previous trauma from this procedure examination, two, make sure the experience is different this time compared to the first time, and I guess like a third one, deciding whether I was going to do it or not, to be honest. Like, there were a few times where I really just almost went, fuck it. So it's that time in my life again where I am due a cervical screening. I got my letter in the post recently, and if you're new around here or don't follow my blog, I did post about my first experience over there. I will do a brief recap, to be honest. So I'd actually walked in with next to no worries or concerns. I was very confident, which is not the norm for people walking in to their first or generally their cervical screenings, because I'd talked to people, I'd done some research and everything said that, you know, it's not painful, it's just uncomfortable. And as a multiply disabled chronically ill person, I've been through a lot of uncomfortable and painful things. I thought this will be fine. I'll manage, no problem. It was a problem. Yeah, there are a few things I think went wrong in that appointment. I feel like I was given no warning for when the speculum was going to be opened, and also I feel like there was no sort of slow open to sort of get used to it, and basically I just feel like I had my cervix ripped open without any kind of real preparation for it or testing the waters, and that was very painful, and it definitely added to my medical trauma and CPTSD flashbacks that I was having at the time, linked to other medical trauma I'd experienced. It was with a nurse that I didn't really like or trust very much, and when I was screaming and yelling in pain, she panicked, didn't know what to do, and she's supposed to be a very experienced nurse, so it did not make me feel safe or comfortable the way all that happened and her reaction. Yeah, she was sort of like, oh, I don't know what to do you want me to just carry on and get the swab, or do we want to stop? And I was like,
oh my god, I'm not doing this again.
I was like,
just get the swab as quick as possible and let me fucking go.
Yeah, so we did at least get enough cells for a test. I think the swab itself was fine. I don't really remember that bit. I think I was in too much pain from just my cervix being ripped open, so don't really remember what the swab felt like. Also, one thing I saw a lot online and was told is that you don't get a letter unless there's abnormal cells. So I got a letter, which was terrifying, but no, it was just giving me my results. So that was another thing that made that experience kind of a lot worse than it needed to be, because I'd been told that you just don't get a letter unless it's abnormal results and you either have to go back or, you know, more investigations need to be done. Having that scare as well on top of everything else sucked. But yeah, luckily we got enough cells They were not abnormal, the results were fine. Now, 3 years later, yeah, I'm not keen about going back. I was at the GP practice last week for a blood test, and I decided to speak to the receptionist and ask some questions. So she confirmed that that nurse I had last time has now retired. So I don't have to see her, at least. I don't remember being given any options. It seemed like only one person did the screenings 3 years ago, so whatever. I asked who can do them now, and I've met all 3 of the nurses or healthcare practitioners, whatever they are, and they are all nice. I do like all of them, and that does make me feel more comfortable. But I did ask if I could speak to one of them on the phone or something, because I'm not due yet. My birthday's in like a couple of months, so I'm not really due for a few months for a repeat screening. I was saying to the receptionist about how my first test was bad, and doesn't make me feel super happy about coming back for another one, even if it is with someone else. The receptionist was a woman, and she was brushing off my anxiety. She was saying that cervical screenings, it's normal for them to be painful, which is not true. Much like periods, it is not normal to be in that much pain. And if it is normal to you, that normally means there's something else happening that hasn't been worked out and explored. And if that's true for me, that if there's something under, like, beyond just the cervical screening that hasn't been addressed yet, then that's fine. But I just don't, after that first experience, I now don't feel safe and comfortable unless I have a conversation with someone first and work out some like boundaries and ground rules. Like, there's a big difference between uncomfortable and pain, and I was so sure it would just be uncomfortable and not painful, but unfortunately it was the other way around. Of course, typical me. So yeah, I just kind of had to advocate for my needs to have access to a phone conversation with one of these nurses at least before I decide if I'm going to book in to have my next screening. So next week, I believe, is Wednesday or Thursday evening. I have a phone appointment to speak to one of the nurses. Some of the things I'll be bringing up is the past experience, telling her a bit about what that was like, what other adaptations can be made. Adaptations? I don't. Because since my last test, I've heard things like the speculum can be exchanged for a smaller one. I don't know if that'll make a difference, honestly, but that's one thing. Different positions as well have been brought up, especially if you are fat or plus sized. I think I'm bigger than I was last time, so who knows if that's going to make a difference. But I also plan to bring up what my mum mentioned to me, because my mum says that she has a tilted cervix, so maybe I do as well. So I want to ask, you know, if that makes a difference, what can be done to handle it around that. I'll also be bringing up the sort of no preparation warning and it all just happening suddenly, and how I would appreciate for it to be a lot slower and have a lot more communication around it, I guess, because I felt like there was communication up until that point. Then I may also ask about, you know, what do they think of the at-home HPV tests? Would that be maybe a better idea for me to do? Because they were running them in COVID for free to get more people to do these tests and also make these tests less scary, because it's basically like a chlamydia STI swab, and the main cause of cervical cancer is the HPV virus. So As I don't think I have any other risk factors in my family history or in my current history for cervical cancer, and I haven't been sexually active in a very long time, so I don't know. Unfortunately though, those tests are now like 50 quid at Boots. They were free when people were sort of taking the pandemic seriously. Now they're not free. Unless I can, I don't know, maybe find another clinic that can provide that. Something I can look into. And then otherwise, yeah, my other options besides doing it myself at home is possibly going to a local LGBT like sexual health clinic, because I know that they provide cervical screenings, and at least they would have some like, I don't know, knowledge, awareness, training around why this procedure might be a bit more traumatizing for some people. Being trans has definitely given me a different relationship to parts of my body, that even though I don't experience like physical dysphoria in like a gender way, I do find it very difficult to have conversations about certain body parts even with my doctor, who I trust and feel safe with. Like, those like conversations feel a lot harder than conversations I've already had for years, because as like a side note and maybe some background context for why as well this cervical screening is anxiety inducing and why I think it maybe was more painful than expected, is that maybe I have some like pelvic issues that I have not had examined or explored, and don't really know if, when or how to approach that, because it's definitely nothing to do with periods or menstrual cycle, anything like that. It's not to do with those things, because even when I wasn't taking my contraceptive that stops my period, or like, you know, I was on the combined at one point where you're supposed to take a week off every month, so I did used to do that when I was younger. Like, periods sucked, but they weren't the same kind of sucked that I've heard about from friends with like endo and PCOS, for example. So it's definitely not in that kind of area. I think it's maybe more muscle based, like pelvic floor muscles, for example, or yeah, I don't, or maybe again there's some link to possibly the tilted cervix that I don't understand because I've not looked into it myself. But I've definitely had problems with you know, like inserting tampons, for example, sexual activity. I don't know how much of this I'll be keeping in. Currently it doesn't give me any issues because I have no partners, I don't have periods, so, but like it might be a good idea to bring up to someone at some point, you know. But yeah, I've not done the research. I don't know who I would speak to where it could be linked to trauma and anxiety. I'm not going to be able to pronounce this correctly. Vaginismus or vaginismus or something is one thing I've seen before. Who knows? Or I think it could be a link to, yeah, like hypermobility stuff. So like my muscles are compensating for ligaments that are too lax, for example, which has meant over the years I've realised I'm almost always tensing muscles I don't realise or need to tense. I noticed it a lot with my stomach, that, you know, I'm not necessarily sucking in, but I'm almost like trying to hold myself. So I wonder if that may have a link as well. But I wanted to share this because these conversations suck and these things suck. So anyway, I will update after I've spoken to the nurse. So yeah, after speaking to one of the nurses one-on-one and booking in and ending up with somebody else, which was fine because I know her, she's already seen me screaming and crying and already been in precarious positions with me. She was the first nurse to redress my surgical wound on my butt, which was horrific as well. And I was screaming and crying then too. So, you know, if I was screaming and crying again this time, she's used to it. It's been a few days now since I had the next cervical screening I was due / I'm required to do. Yeah, in the UK, you're basically required to do them every 3 years, regardless of your sexual activity past the age of 25. And that's if you don't have any other risk factors until, I don't even know. When do they stop? You still have a cervix after menopause, so do they stop? Do they lessen? I don't know. That's one thing I still don't know after all this. But if you do have risk factors, you're basically required to go in yearly, and may even go in earlier than the age of 25. One of the main causes of cervical cancer is the HPV virus, but also if you've had the HPV vaccine, which in the UK is as well. When I was in year 8 or 9, so around 13, 14, it was just introduced around then for everybody to get them. Like, it was 3 jabs over the course of like a year, I think. Yeah, and that greatly reduces your risk of cervical cancer caused by HPV, I guess. I also learned in this recent screening that actually they don't test for anything else anymore. They only test for HPV, but will keep your sample on file for a while in case they need to test it for other things. I don't know what exactly would prompt that. I suppose obviously if the HPV comes back positive, they'll test it. Maybe if you're going to the doctor with symptoms of fucking cervical cancer, maybe they would test it again. But I don't know how long they keep it for. But you do get them every 3 years, so I don't know. A lot of samples or data tends to be about 7 years being held. That's some general gist of stuff that was in my mind before and also during the assessment, where I was like,
Do I just run now?
I went in with 4 milligrams of diazepam in my system. I'm pretty sure it does nothing to / for me. I have next to no anything. Like, it just doesn't feel like I've taken anything. It's supposed to be a muscle relaxant / an anti-anxiety medication. My Fitbit will tell you I was still anxious, and I will still tell you that my muscles were not relaxed. And I took it at the time they told me to. I also had my CBD vape pen at the time, which I got through within like 4 days. So, but you know, I was trying to be focused, because like, here's one of my issues is I think I have a link with my hypermobility / connective tissue disorder, is that I spend a lot of time clenching really strange muscles to stay upright. And along with my Crohn's, I've had to clench a lot of my butt muscles because of the constant fear of diarrhea, to be honest. So I think a lot of those muscles in that area are just permanently tense, like clenched, unless I'm literally thinking about relaxing those muscles. Like, I've just had to think about it now because they were not actually relaxed. So I think there's that. There's also like a anxiety around insertion of some kinds, because I have always found penetrative sex painful for the most part, even with the right things being done. I hate talking about sex, but it's kind of relevant here. Whether that's a trauma response as well, or maybe some other kind of health condition that I've not had explored yet. Also something that's not really been a main priority for me as a chronically single, chronically ill person. It's been more than 4 years since I've been near anybody romantically or sexually, so not high on my priorities list right now, love. Next up is POTS. So if you want to know more about POTS and what I've had to fucking deal with and go through for that, let me know, because I know there's a lot of you out there as well who haven't had the diagnosis yet and probably feel like a shit because of it. But anyway, yeah, so there was little information on like my GP practice's files from the first time. All it said was I have a tilted cervix, which I learned this time round as well is actually extremely common. So if it's extremely common, why don't we have anything better than sitting on our own hands to make seeing the cervix that is tilted easier? That was all that was on the system, was that I had a tilted cervix. There was literally nothing else put on there, like the size of the speculum, the fact that I had a fucking screaming panic attack on the table and was in loads of pain. Not on the system. Thank you, and I'm fucking glad you retired, you useless bitch. Yeah, you know, vibes. I bled after the first time. I definitely needed like a sanitary towel, period pad, whatever the fuck you want to call them, because I just don't refer to them most of the time because I don't need them because of the pill. But yeah, this time around was different. I went in, the nurse talked me through things a lot more anyway. I did let her know that, yeah, obviously I've had quite a bad experience before, and I'm just trying to see if I can get through this one and see if it's something I could actually manage to do by myself or you know, to do regularly. She had read the previous notes left by the nurse I spoke to on the phone, which was helpful because at least she knew more of what was going on. Yeah, we went through the form. I don't know, she definitely talked through things more than the first person did, although I can't really tell you exactly what because I was still in like survival panic mode. Just trying to get through this. I'm gotta get through this. That I know that's not how that goes, but I'm extremely tired. I've had a time. I'm having a time. Just at the moment, I'm having a time. For the most part, it seems like now they tend to use the smallest speculum, especially if you've not had a child. So that's what we did. We tried that first. I got on the table. Actually, I changed my mind. I was like, can I actually look at the speculum? Because this is the thing. Part of what I struggled with from the first time's bad experience was I didn't know how the speculums worked. You know, whether they just automatically open to a certain width right away or whether they have more control over it. Turns out they have more control over it. So it is a lot more like a hinge, like the thing they squeeze, it's controllable. It's not just a whack, which is what happened to my cervix the first time. Yeah, more reasons I'm still pissed at that first nurse. This time round, with this nurse and the one that I spoke to on the phone before, like we had all agreed that, you know, we would just take things really slowly and would only slowly open the speculum and all that. So yeah, I got into position, sat on my hands. We used the smallest speculum. Also, the smallest speculum is a little bit shorter in like depth, so that's why sometimes it's not always the best one to use. We did then try the size up for her to have a better view, but unfortunately that was just far too painful. There was something different about that pain that was similar and reminiscent of what I was mentioning earlier about just penetrative pain, whereas the pain I'd had in my very first cervical screening was the cervix pain. Two very different pains to be aware of. So yeah, we couldn't insert the next size up and we went back down to the small one, but we adjusted my position a little bit by me sitting on fists. I sat on my fists this time to get more of a tilt, and this is why I would like to know why we don't just have I mean, I know the NHS has fallen apart, full stop. They don't have any money for anything, but you know, it would just be nice to have like a pillow, or like, you know what they use for yoga, like a yoga block, exercise block, something like that. You know, like something between a a exercise block and a pillow, maybe like a solid foam wedge, you know what I mean? Because not everybody can sit on their hands, and to be fair, I probably couldn't sit on them for that long. But yeah, basically we were working really slowly with it, seeing how it felt. She also described that the sensation I should be feeling is a pressure, which I can now understand what she means. But also I was still feeling a sharp pain on my cervix when the speculum, the small one, was involved. But the thing is that this time around, because it was done so much more slowly and, like, you know, little bit by little bit, and she would always stop if I said ow or anything like that, it was more bearable, to the point that I do feel like I have probably gotten over the original trauma I had from my first cervical screening. And yeah, as I said about the muscles thing, I say that because obviously you need to, relax. You need to relax everything down there, but also you kind of need to have, I don't know how to describe this, but like, because to me it makes sense, because I've had a lot of really awful and not fun examinations of my body, that, you know, this description makes sense to me. It might make sense to other people with like Crohn's and shit and whatever, but it almost feels like you have to push sometimes. Like, particularly for me, as somebody who is always tight, tense, you know, muscles just flexed. The opposite of that tension is a push. Do you understand what I mean? Like, I can't, it's the feeling when you go for a wee, but like, that's how it feels, is letting go after you've been holding in a wee for a while, where it's kind of like not just letting go, but almost like pushing. Okay, so like, I had to purposefully think about doing that with those muscles whilst in this position to make it fucking doable. I don't know, but yes, so that all happened. We got the swabby brush, spiky broomstick is what I call it, even though it's literally like this. It's not really a broomstick shape, but in my brain it's a spiky broomstick. Another sensation I didn't experience the first time was what the swab feels like on your cervix, because I was in so much pain the first time round. Who knew? But yeah, so luckily that wasn't actually painful. My gran said it was painful when she has had to have cervical screenings before, but she's also not had them for like 40 years. So maybe the swabs are a little bit different, you know? Maybe they're not as actually spiky. They look spiky, but like, yeah, that wasn't painful. It just felt weird. And that's what I said to the nurse. I was like, yeah, that feels similar to this. Confused and surprised her a bit. But I said it feels similar to when she was removing the dressing from the hole in my butt from surgery after an abscess had been drained. Because basically, both of them are an inside body feeling, and it feels wiggly. Like, I have no other explanation here or description for you. It feels wiggly inside, okay? So that's my description. I hope that makes you feel great about going for your cervical screening. Also, yeah, I don't call them smears. I hate. Why the fuck would I want to call it a smear? Disgusting. Why the fuck would I want to call it a smear? Just call it a cervical screening. That's what they're called now. Please just call it a cervical screening. Stop saying the word smear. Also, another thing that was said to me this time that was a bit different to last time is that people on like a contraceptive pill are more likely to have contact bleeding from the swab. So she warned me that I may have some contact bleeding. I was like, okay, well, I bled afterwards last time, so I wasn't particularly yeah, that's like the least of my worries. I brought a pad, and she was like, well, I don't think you'd even need it. And to be fair, she was right. I actually didn't, if there was blood, nothing came out. Whereas the first time must have been so traumatic and painful and horrific that I actually bled quite a bit last time. And I was sore like the first time. The first screening, I was sore. It hurt for a few days. After this one, it didn't. And I am so mentally unwell. I'm so mentally unwell. If there is a God, why do I need to go through all of this? Why? Do I not go through enough body horror already? Like, please hold off. On the medical trauma. I really don't need any more. My plate is full, babes. You know, there you are. Like, obviously everybody is different anyway. But I would say quite confidently that if your cervical screening was painful, that is the healthcare provider's fault. Like, it doesn't need to be that painful. Most of the people I've spoken to have said it's uncomfortable, which was why I wasn't worried the first time I went. And I just ended up with a healthcare provider that also I just couldn't trust anyway. It turns out she's caused me harm many times. So that's why I believe that if you've had a really painful cervical screening, it is the healthcare professional's fault. They are not taking the time necessary to adequately tend to your emotional and physical needs in that situation. And as both of the nurses I saw or spoke to like recently have said, that they want to make the experience as good as possible so that you come back, because, you know, a lot of people who do end up being diagnosed with cervical cancer, it often ends up being in one of the later stages, which is a lot more difficult to treat and more risky to your life. You know, babes, as my original thought process went, I've been through a lot of medical bullshit to hopefully avoid more medical bullshit. You know, doing one of these every 3 years is not so bad. And I now feel that way again. But like, yeah, unfortunately, it has taken me a lot to feel that way. I don't know if I've mentioned this in any of my clips, but I did also have to actually do trauma therapy on that first experience. I did EMDR with my therapist on the first cervical screening experience because it really traumatized me. Both a mixture of, like, it was after I'd already been traumatized when it comes to cannulas and blood tests. It had a lot of similar feelings to that, you know, I didn't have much control over my body. I didn't have autonomy in those moments. I felt trapped, and I just kind of felt like I didn't have control or consent in that situation. So I had to do EMDR therapy. Again, if you would like to know more about EMDR and what my experiences have been like, let me know in the comment section, because I've not really gone into huge depths about it yet. But I had to do it because it was another one of those things where I felt terrified in a very familiar space, and to be able to keep going with other medical testing and things like that, I needed to feel as safe as possible in that room. That nurse, I think I saw her for maybe one or two other things after that. One of them was a dressing change as well, and she was the worst one. Like, she was the most painful person besides the very first time it was changed during the whole 5 months I had to keep dressing my butt cheek. You know, it's like, I chose to never see her again. Needed the therapy to get over it because I was having flashbacks to it, with it, whatever the right word would be there. And it was in a room where I am like every I don't know, every week to every few months for my blood tests. I did have to go through all of that within the year or so after my first screening to even prepare me to even start all of the other work I did for myself this time round. And it also, you know, gave me the ability to just ignore the receptionists. Oh my god. The receptionists really like to have an opinion on whether something being painful is normal or not. Babes, shut the fuck up. Did I ask you? Shut the fuck up. I'm telling you, I would like to speak to a nurse first on the phone because last time was so painful. I left with trauma. Thank you very much. Shut the fuck up. It shouldn't be that painful. It should not be that painful. But yeah, that's basically the journey now. Here is the journey. I feel somewhat accomplished that I've been able to get through that and now feel less concerned for the rest of
time.
Or I have to get these fucking things done. If you have any questions that you would like to ask or any tips that you would like to share that might help other people as well, leave those in the comment section below. Like the video, subscribe to the channel, share the video if you like as well. Helps the algorithm. And you know, even with all the information out there that's being put out there, particularly by like Joe's Cancer Trust, I was still not prepared. I did a lot of research, speaking to people and reading up things online, and I was still not prepared for that first time. So I feel like at least my story here gives you kind of like a step-by-step what you can do to prepare yourself, prepare your healthcare provider who will be doing the examination. What the fuck, I've already forgotten what it is. Screening. Which I haven't seen really lined out in that sort of way. And also, if you aren't sure as a trans person that you will receive quality care at your local GP's surgery for a screening, then I definitely recommend looking into going and speaking to an LGBTQ plus healthcare clinic. I think they do them at sexual healthcare walk-ins, so you should be able to access the same care there. There are also the ones that you can buy over the counter and do swabs at home that only test for HPV, but like I said, they only test for HPV now. But the one thing with that is it's not in place everywhere, so I don't know if every GP will accept it, because that was something that neither of the nurses I spoke to recently could give an answer on. Just that basically my GP service doesn't use or work with the at-home swabs, so that's also something that may be worth mentioning, especially if you're bedbound, for example, housebound, or have any other issues that may have come up in this video or may not have come up in this video. Yeah, hopefully that's helped some other people. I need to just go lay down now. I'll see you next week. Bye. I can't reach you.